Liver function test, serum bilirubin. Bilirubin occurs in blood in plasma in four forms: unconjugated, free or unbound unconjugated, conjugated, and delta bilirubin. So the first one, unconjugated bilirubin. What we already know about unconjugated bilirubin is only discussed here. So it is going to be bound to albumin. The free form is not bound to albumin. Because it is not bound to albumin, it will be able to cross the membranes. So it is responsible for kernicterus in the kids. Conjugated bilirubin is the only fraction to appear in the urine. The delta bilirubin is nothing but a conjugated bilirubin bound to albumin by covalent bonds. Usually, conjugated bilirubin is not bound to anything, it's not bound to albumin specifically, but some amount of conjugated bilirubin may be bound to albumin. And this bilirubin is known as the delta bilirubin. The delta fraction permits the conjugated bilirubin to persist in the circulation and delays the resolution of jaundice. Because so the person having delta bilirubin, jaundice is going to stay for a lot of days. That is only delta bilirubin. So, okay, isolated elevation of serum bilirubin, unconjugated hyperbilirubinemia. The causes of unconjugated hyperbilirubin to be very high includes a lot of things, six major subdivisions. The first one is hemolytic disorder. Hemolytic disorder. The second one is hematoma, a large hematoma. Third is with respect to the kids, so like physiological jaundice of the newborn or breast milk jaundice is the fourth one. Five and six are miscellaneous ones. Fifth one is drugs. Six is genetics. So basically, the first one is so basically it's going to be two with the blood, hemolytic disorder and large hematoma. Two with the babies, so physiological jaundice of the newborn and breast milk jaundice. And five is the drug, and six one is genetic disorders. So the hemolytic disorders include hereditary spherocytosis, sickle cell anemia, thalassemia, G6PD deficiency, megaloblastic anemia. So what's special about hemolytic disorders is that the bilirubin level which we are looking at a value of 6 to 7 milligrams per deciliter. The normal the value above which we will be able to visualize the jaundice is going to be 2.5 to 6 mg per deciliter. So over here in hemolytic disorder is going to be slightly above that value. Increased reticulocyte count is the hallmark, okay, of hemolytic disorders, because all hemolysis is happening. The reticulocytes are the only cells which are going to be like the first cells which are like proliferating, just like a mushroom from the rain of the previous day. Moving on to the large hematoma, it's just having a lot of blood and it's going to get lyse, which is also causing unconjugated hyperbilirubinemia. Physiological jaundice of the newborn, decreased conjugating enzyme activity. It never occurs on day one. It usually occurs after 48 hours after birth. So, like the conjugating enzyme is going to be the uridyl UGT some shit. Okay, and then the breast milk jaundice. They say it is UGTA, but I'm not sure. Breast milk jaundice is glucuronidase is present in the breast milk, which deconjugates the conjugated bilirubin. Glucuronidase, okay, glucuronide is just is only added to the glucuronide is the thing which is added, okay, to bilirubin to conjugate it. But like to deconjugate it, removing the glucuronide is done. So that is done by the enzyme called glucuronidase. So like killing the fat is going to be lipase, killing the sugar is going to be amylase, like that. Okay. Moving on to certain drugs, the drugs include rifampicin, probenecid, novobiocin, flavispedic acid, cholecystographic agents, and ribavirin. All these drugs are also going to cause unconjugated hyperbilirubinemia. So these are the drugs. So like anti-TB drug, rifampicin, anti-some shit drug is probenecid, and the final one is like my favorite name, which is novobiocin. Sounds nice, okay. Ribavirin is kind of like anti-TB drug, I think so. I'm not sure. It sounds like some sort of anti-HIV drug. And then genetic disorders, impaired bilirubin conjugation disorders could also be there. So the genetic disorders which causes unconjugated hyperbilirubinemia, as we already know, is going to be Crigler-Najjar syndrome and Gilbert syndrome. Okay, so with this, we are just ending it. We read the types of bilirubin.